My name is Jeff Beselt. I'm a dad, husband. I live on traditional and unceded Liquitok territory, also known as Campbell River, and I work as an emerge doc and as a rural doc in northern BC in Tsay Dene and Quaracha First Nations.
I'm Karen Forgie. I'm a full-service family physician out here on the Sunshine Coast. We're presently in Beselt, and I've been here since I was a resident back in 1991.
My name is Bruce Hobson. I am a refocused family physician, now working in areas of my passion around educational design and delivery and mentoring and coaching others.
I'm Garnett Tarr. I'm a GP in Soos, British Columbia. I've been here for 25 years. Originally born in South Africa, Mpumalanga, which is in the Eastern Transvaal near the Mozambican border. After qualifying an internship, I took a locum position in Redville, Saskatchewan, of all places. And it's my birth home in Canada, if one calls it that, and consider myself a stubble jumper to an extent. After 10 years there, I took over a practice in Soos, British Columbia, and have been here since. Rural physicians do have a significant role in community, and it's hard not to be part of community when you're responsible for the health of a large sort of swath of your community. I don't think so much it's a responsibility, but it's a good outlet, it's a good place to see your patients in another light. But in general, it's been a positive experience as far as I'm concerned.
I always say when people talk about life work balance, I say, well, in a rural community, there's no such thing as a balance. So if I was standing on the sidelines of a soccer game and someone got hurt, it was, hey, there's Doc Bruce, get him over here.
We're also community members, and the more you're involved in the community, the more leadership roles you can take on that have nothing to do with medicine or are intricately laced to medicine.
I love what I do, and that's why I participate in the types of care that I do, and just getting to be part of a team. And it's totally changed my life, my perspective, how I think about things, and it's changed that of my spouse and my kids as well.
I started out as a nurse practitioner or outpost nurse and midwife working in Newfoundland and Labrador. And what I really liked about all of that was the small size communities, getting to know everybody there, and being able to do so many different things because the role was so general and allowed for so many opportunities. When I went into medicine, I decided that I was only going to apply to rural programs. And I was very clear to everyone that I was going to be a rural family physician.
I have a picture of me in grade 4 when teacher asked us to draw our future. And I was in a white coat, and I had a needle in my hand sticking it into someone's butt. So, from early on, I knew I wanted to be a doctor.
When I finished my training in Prince George, I had the opportunity to go work in Tsay and Quaracha, and it changed everything for me. I didn't realize that true generalist medicine existed in the way that it did, and it's the part of medicine I love the most.
Be curious, say yes, maybe a bit more often than you'd like, or that you should, and try things out and meet people. The people that I've met through the things that I've said yes to have been people that have really inspired me.
I wish I could say it's a job for everyone, but it's most probably not everyone wants to do these jobs, and it's one of the hardest parts of medicine is encouraging people to take on these sorts of roles.
Taking the risk to try something like that is so worth it. And so I would just totally encourage those who are thinking about doing rural, just do it. You're never going to have enough training. Just go and try it out, and then you'll figure the rest out with those around you.